Assessing the deviation index, or DI, is extremely important in radiography. This is our numerical assessment of whether our image is over or underexposed. An acceptable DI range should be between +3 and -3. There was a time where we could just look at an image visually and tell if it was over or underexposed. That was our film screen days, where mask controlled exposure and that controlled density. So if you were overexposed, you could tell it a mile away the image was too dark. Underexposed would result in an image that was much too light. Now with our computer technology, the computer controls image brightness through rescaling. So whether we over or underexpose, our image brightness is always going to be adequate. It will always look fine to our eyes. So we have to look at the deviation index. Again, it's +3 to -3. So if we're overexposed, it's going to be a positive number. If we're underexposed, it's going to be a negative number. Let's deal with underexposure first. If you're more underexposed, so you have like a -4, -5 deviation index, more negative than -3, you're going to have quantum model, which means a very grainy appearing image. Now that may not be readily apparent to you as technologists because the monitor quality that we use as technologists is much lower than the monitor quality that the radiologists use for diagnosing the image. So what we may not even see as graininess, it will appear plain as day on the radiologist's monitor, and we'll end up having to call that patient back for a repeated exam. If you're overexposed, you're going to be in the pluses. So if you're more overexposed than +3, like +4, +5, and so forth, we have overexposure, which results in low contrast. So contrast is one of the most difficult things for a technologist to assess. If the computer controls contrast through the lookup table, but we can lower it even more if we have overexposure, if we've set incorrect techniques. Therefore, it's going to lower it beyond what would be ideal. For most of our patients, we get away with that, but for those really difficult patients, maybe because of body habitus or pathology, they're going to be displaying with low contrast anyway, and if we overexpose it in addition, it could potentially lower it below the diagnostic range, and so therefore we may have a repeat. If we are grossly overexposed, meaning more than 4 to 5 times the acceptable exposure, then we get what's called saturation, where those pixels are going to display the blackest black that they can display. So we lose the difference between adjacent densities. The pixels are all going to be the same color. We will not be able to bring that back through window level, window width, and therefore we lose the diagnosis. That patient would need to be re-exposed. So we've overexposed them, creating a problem. Now we have to double their exposure by exposing them again because of our incorrect techniques.